Hello and welcome to The Print. A cruise ship bound for Antarctica has become the center of a rare and closely watched hantavirus outbreak. 8 people across 23 nationalities have been infected by this virus. Three have reportedly died. The Union Health Ministry in India has informed that there are two Indians on board this cruise ship, and both are currently asymptomatic. Now, WHO has said that the strain responsible for this outbreak is called the Andes strain, which is the only hantavirus known to spread between humans. And also, WHO Director General had on Thursday during a press conference, he said that the global public health risk of the virus remains low. But because the incubation period can stretch up to around 8 weeks, we can possibly see more cases in the coming weeks. Also, in India, the health ministry has reviewed the situation and reportedly stated that there's no immediate public health risk or concern. So, what exactly is hantavirus? How dangerous it can be? What does this Andes strain really is, and how differently does it behave? And what lessons does this outbreak hold for countries like India? To discuss the science, the risk, and public health consequences and implications of the current outbreak, we are joined by Dr. Shahid Jameel, who's a virologist, a research fellow at the Green Templeton College, University of Oxford, and Dr. GC Khilnani, who's a chairman of PSRI Institute of Pulmonary, Critical Care, and Sleep Medicine in New Delhi. Thank you so much for joining The Print.
Thank you.
Thank you. My pleasure. My pleasure. Sneha. Yeah.
Yes. So we'll open this discussion by asking Dr. Jameel, first of all, that WHO has confirmed that this outbreak involves the Andes strain. Can you help us, understand initially more about this virus, the Andes strain, and scientifically what makes it different from other hantaviruses?
Well, the hantavirus is a group of small RNA viruses, uh, which are typically found in rodent populations, mice and rats and other rodent species. They're really different sorts of viruses belonging to this family are present across the world. This Andes strain is endemic largely to 3 or 4 areas of southern Argentina and southern Chile. It and there are other viruses belonging to this family elsewhere. I recall a virus called the Sin Nombre virus or the Four Corners virus, which emerged in the United States, the western part of the United States, in 1993 and caused an outbreak in the American Indian population that was living there. So these keep coming up, and there are interesting stories with that virus, but I won't bore you with that at this time. Um, so these viruses are endemic to various rodent populations, and it so happens that this particular ship actually docked, started from Argentina, and the very first case that died was actually hiking in these southern districts of Argentina, where this virus is endemic. So I think this person possibly caught this virus from a rodent in one of those areas. The other thing, as you said in your opening, is that the Andes strain is about the only strain of hantavirus which passes not very easily, but relatively easier to pass between humans. Otherwise, it's normally a transmission from a rodent to a human and not very efficiently between humans. Um, so that's all we know about these viruses at this time.
All right. So, when people hear human to human transmission, uh, immediately they think of COVID-19, right?
Yes.
Coronavirus. And there's a lot of interest thereafter. I mean, after COVID, we see that every time a virus uh, comes up in media. There's a lot of interest in people. So if you could help our audience understand why are experts saying that this is not a super spreader scenario, as you said in our conversation this morning as well, despite the infections that are occurring on a cruise ship, uh, why is this not a super spreader event, and how is it different from COVID?
Okay. Well, how is it different from COVID? These are completely different viruses to begin with. But let me go back to COVID and that family of viruses, the SARS coronaviruses. If you recall, in 2002, there was an outbreak of another coronavirus, which was called the SARS coronavirus. The COVID virus was called SARS coronavirus 2 because it was the second coronavirus that came in human populations. And the first coronavirus caused a total of 8,000 infections and about 800 deaths. The second coronavirus caused a pandemic. It caused millions of infections and millions of deaths. Same family of viruses. What was the difference? The difference was that the first coronavirus was only transmitted from a human to human when people were symptomatic, when they already had had symptoms. And when they had symptoms, they were usually isolated or hospitalized or whatever. So the chances of passing it on to somebody was much reduced. Whereas SARS coronavirus 2 was also transmitted between humans when people were in an asymptomatic condition. And that really made all the difference. You are running around with a virus and you don't know you have it, and you're giving it to everyone. So my suspicion is that even this virus, the hantavirus, is not transmitted very easily when people are asymptomatic. It is really transmitted better towards the late incubation phase when symptoms start appearing. That could be one reason. The other reason is that normally these hantaviruses cause lung infection. And if a virus is deep seated in the lung, it is more difficult for it to infect somebody outside other than a virus which is primarily in your upper respiratory tract. You can sneeze it out. You would have to cough this virus out really hard for you to be able to infect somebody. So I think these are some of the features which I think are behind low transmission, human to human.
Okay. We'll come to the question on human to human transmission and the way it really spreads, which is very close contact. And also, I'll come back to hear from you the story about the 1993 US spread of the
Uh-huh.
virus in four corner regions of the US.
Yeah.
But we'll ask Dr. Khilnani now that the hantavirus presents in different ways in different parts of the world. So we know that the New World strain that is found in the Americas, it attacks the lungs, whereas the old world strain, which is found primarily in Asia and Europe, and that targets kidneys. So, can you help us understand some of the critical symptoms of these infections, and critically, what makes hantavirus so dangerous when someone is infected with it? What are the symptoms?
So before I go to that, I would like to further comment on Dr. Jameel's comment that we have to understand how normally the hantavirus spreads. As we know that it is in the rodents, it's not a droplet infection classically. The urine and the saliva and other secretions of the rodents, they are dropped on the surface, and then after the drying up, the virus is still alive. And when this dust or whatever you call it is inhaled by the individual, there is a potential for causing infection. Then attack rate is not very high. That's why the total number of cases in the world, predominantly in China, Russia, and Korea, are not large. Number one. And yes, there are two types of virus. I mean, majority it can be divided into two. One is cardiopulmonary, another is kidney and hemorrhagic. Now, these viruses are several types. Dr. Jamil knows more than me, and I'm not a virologist. But the cardiopulmonary virus is the lethal virus with the estimated mortality of 30 to 50%. But as I understand that they all start with like any other viral illness, and uh, fever, cough, headache, and whatever. The cardiopulmonary will present typically like ARDS, acute respiratory distress syndrome requiring ICU care and ventilator and so on. Whereas the hemorrhagic and the kidney involvement will be actually part of the multi-organ failure where the renal function will be deranged. But that's not the only thing. The other organs also get affected. The overall mortality, as I came across in the literature of the hantavirus, is about 5%. There is a panic around because of the memory of COVID is will never go away from. There's nobody in this world who has not lost a friend or a family or a very close family member. Some people are still disabled and they attribute every symptom that they have is to COVID. That's why every outbreak is causing a panic. But I would also like to convey through you that there is absolutely no need to panic. This is not a virus comparable to COVID virus or influenza virus. The attack rate is very low, but yes, this antivirus, those people who were exposed to this particular ship or whatever vessel, they should be under surveillance for a period of 8 weeks. And of course, the tests are available at the advanced laboratories. The question is that whether they should be quarantined. That's a very difficult question to answer because to keep a person in lockup for 8 weeks is actually very difficult. So it's for the WHO and the government and the policymaker to decide whether the 130 or 150 people who were on board and who are healthy are restricted from moving around and what level of uh, quarantine is required, whether they should be homebound or room bound. But if they get symptoms, they should be tested.
So, from a virology and surveillance perspective, I want to ask you, what should Indian health authorities realistically be watching for right now?
Well, I mean, it's quite obvious that the outbreak did not start from India. The outbreak started on a ship, most likely somebody who got into the ship from a point in Southern America. Now, a ship is a closed environment. Uh, you know, there are people from 23 different parts of the world coming together, 150 people on a ship. They are eating in the same spaces, they're living in the same spaces. So obviously, it's a closed environment, and uh, it is possible that the two Indians on board could have been infected. There's also a possibility that they are completely virus free. So, as Dr. Khilnani said, it is very difficult to keep somebody in quarantine for 8 weeks. The sensible approach would be to watch them for symptoms. This is what health authorities have done in South Africa, in Netherlands, in Germany, wherever people from the ship have gone. They have let them go home. They have asked them to monitor themselves. And remember, there are these people, Indians who were on that ship, are likely to be rich, educated individuals. They would know how to monitor themselves. We are not looking uh, uh, at somebody who's out on the street. Uh, and so, I think a sensible approach is needed where you let these people self monitor, and maybe if there are symptoms, report to their physicians with the history that they were on that ship. Uh, Beyond that, I don't think there is really any need to do anything.
All right. Because we're talking about symptoms, Dr. Khilani, like early symptoms, for example, fever, vomiting, and body ache, like you described, they resemble like a lot of other types of diseases, dengue,
Yeah.
and even other types of influenza. So how difficult it is really for doctors, not just hantavirus but other kind of viruses, even they manifest in quite similar ways. So
So,
in those cases, how is the identification really done? Or does it mean that a lot of people might be having these viruses we don't know because we are not tracking?
because it is actually impossible when the person present to us with a short-term fever, cough, and sore throat, or maybe chest discomfort, to actually say which virus it is. At best, we say that it is likely to be a virus. That's why it is called flu-like illness, or some people also say viral-like illness. It is the test which will bring out whether it is the. So, if I was to treat such a patient, any person with the viral-like illness or flu-like illness, I'll immediately go for something called a throat swab and test it for influenza virus, COVID virus, and RSV virus, and whatever virus tests are available in the laboratories in India, which are not many. So similarly, the hantavirus also has a PCR, polymerase chain reaction, but this test obviously is not widely available because this infection is very rarely. If I talk about India, it has been reported from Mumbai and CMC Velo, that is Tamil Nadu, and actually they have tested rodents also, and they have found hantaviruses in them. So it's going to be difficult. So as Dr. Jameel said, these two people have to be kept under surveillance without locking them up in quarantine. That if they develop any symptom, and I insist, be it body ache, be it headache, be it vomiting, be it any illness, and they should be isolated and tested with the serology and also the PCR, and then it can be diagnosed. But no pandit can, by clinical examination or symptoms, can say that it can be hantavirus or coronavirus, or it can be COVID virus, or it can be influenza, or respiratory syncytial virus, rhinovirus, and there are many. There are many.
Okay. Sir, as you spoke about, the virus hitting Tamil Nadu and some, I think Mumbai, you said. So there is evidence. I think there are papers I was just going through this morning, one published in the Nature, about hantavirus exposure reported in India in the early 2000s. So particularly among tribal and rodent exposed communities in Tamil Nadu. uh, what if you've tracked, what do we know about how, just for our audience to understand more about exposure in India to this virus, what do we know more about how those infections may have spread
So
at that time?
except this antivirus, which is Dr. Jamil has said that it is likely to be transmitted from human to human. The standard the hantavirus is not transmitted from human to human. It's not that one family member is affected, so rest will also be affected. It is transmitted from rodents to human beings through non-living things. You know, because some people are fond of even keeping it at pet also, rats and all, but very few. But actually, it is through their secretion that it is so. It is never in the form of any kind of outbreak or epidemic. These are sporadic cases which are diagnosed if you have advanced laboratory, and I believe that it must be more common than diagnosed in India because the diagnostic facilities are minuscule. Because the test must contain the primers for that particular virus, which is not there. Even I don't think in Delhi we have that facility. Dr. Jamil can further elaborate on the
Yes, Dr.
testing.
Shami, do you
Well,
want
I I think these days, with India developing a lot of genomic sequencing during COVID, it should be possible to very easily find out, in case somebody shows symptoms, particularly these two individuals, whether they have hantavirus or not. But really, I mean, I don't think we should panic at all in this case. As far as the question you were asked about the tribal community infected in 2005, I'm not surprised. I mean, this is a virus that is found in rodent populations. Rodents are the largest mammalian species on Earth. And after rodents come bats. So if you take simply by probability, the interaction between a human and a bat or a human and a rodent is likely to be much more than the interaction between, let's say, a human and a tiger, for argument's sake. So, tribals live in forests or at the edge of forests. Rodents are plentiful on the forest floor. Tribals may also be killing rodents and eating them. Several tribal populations do that. So there could be many ways these infections could have passed on. But the point that Dr. Khilnani made about how these viruses are transmitted from the urine and saliva of rats. A rat biting you and giving you the virus is highly unlikely. But an infected rat putting urine on a surface and you picking it up from a surface is more likely. I'm not saying this to scare people, but consider cold drink cans stacked in a go down somewhere, which is infested with rodents. And these rodents are depositing their urine on the top of soft drink cans. The can goes to the market. You open the can, put it in your mouth. Transmission, possibility. So if people are worried, one thing I would very strongly recommend is don't drink directly from a can. Put a straw in the can. If you want to drink straight from a can, wash the can and then drink from it. These are possible scenarios. I'm not saying it will happen like this, but these are possible scenarios. And if
Because
people are scared, they should use these
because
techniques.
you're talking about possible scenarios, I would like to ask you a very common sense question again. That a lot of our spaces, private spaces, are infested by rats quite often in India,
Yeah,
uh,
yeah.
due to unhygienic conditions. The people live in different settings. So, what should they be worried about being infected?
No, I'm not suggesting that you go about killing rats and mice that are in your dwelling. You can maybe have a cat that will take care of them, or you chase them out. I mean, don't go about killing animals. But as I said, the possibility of you being bitten by a rat is rather remote. But a rat, maybe eating something and then you eating the same fruit or something is far higher. So be careful. Don't eat, food that you think might have been contaminated by rodents.
Okay.
That's a sensible approach.
Okay. India has reported evidence of hantavirus exposure in the past, as we were just talking about, and especially related to renal syndrome strains that were seen in Asia. But I'll ask you one more question, Dr. Jameel, on the 1993 outbreak that you spoke about, because it was an interesting story.
Right. So 1993, there was an outbreak of a respiratory illness in an area in Western US, which is called Four Corners. And it's called Four Corners because four states, Colorado, New Mexico, Nevada, and Utah, have borders there. And right around that place, there is an American Indian reservation called the Navajo Reservation. So young men and women uh, suddenly started dropping dead. And these were very healthy people who were dropping dead, and one didn't know what was going on. And when they did investigation, they found out that they were infected by this hantavirus called the Sinombre virus, which was at that time called the Four Corners virus. But more interesting is traditional American Indian folklore, which said that in the years that they had a good harvest, a mysterious disease appeared that caused healthy people to suddenly die. And then they didn't know what it was. And it turned out that in the year that the 1993 outbreak happened, it was a good harvest. So, how do you link harvest to death? Well, a better harvest means you're storing grains, more grains than usual, and that grain is, also attracts more rodents. Rodents, because they are nutritionally sufficient, reproduce much better, and their population grows very quickly. So, in a good harvest year, you get more rodents. More rodents means more transmission. So that I thought was a very, very interesting story that traditional knowledge knew about it, but didn't make the connection. But when in the early 90s this happened, they could finally discover this new virus.
Well, thank you for sharing that story with us, Dr. Khilnani. I would like to come to you finally with a question about. So, there's currently no specific, antiviral treatment or any vaccine because the virus is obviously not that widespread. So, in severe respiratory cases, if you could help us understand what does supportive care usually involve in these cases.
So we try not to give antibiotics. That is one. The symptomatic treatment involves like paracetamol or antihistaminics, cough syrup, steam inhalation, and so on and so forth. But unfortunately, in India, everybody gulps antibiotics. Azithromycin is like it's in the tap. Same thing happened in the coronavirus also. But there are some red flags which everyone should understand because simple influenza also kills. H1N1, H5N1, all these outbreaks keep coming and patients on ventilator, they die also. So nowadays, everybody has a saturation probe with him after the COVID. That is one. When these patients, after getting, say, sore throat, cough, or chest tightness, or feeling terribly unwell with running nose and blocked nose, if they become breathless, if they are short of breath, and if they put a probe and then the saturation goes below 1992, that is a red flag for them to immediately seek medical care. It's not that none of these viruses have antiviral drugs. Influenza has very good antiviral drug in the name of oseltamivir. But earlier you address the serious viral illness better it is, but I cannot actually tell you how to recognize hantavirus in first few days when actually the lung or the kidney is not involved. So the surveillance is important, as said at the outset by me and Dr. Jameel also. These two particular persons who were on the board, uh, if they are okay till 8 weeks from whatever from now, they don't develop any symptoms. We are in a green zone. There's nothing to worry about hantavirus.
All right. I think that is it for the discussion today. Thank you so much for
Thank you,
joining,
thank you,
Dr.
thank you
Khilnani
very much.
and Dr. Jameel.
Thank you, thank you.
Thanks so much. Thanks for watching the print.